Alcohol and drugs were something that was in my house since I was born, pretty much. So at 22 years old, I had a medical issue, which was a miscarriage. And they gave me prescription pain relievers. And I started taking those then. It felt good, you know, it would take the pain away and it felt good. I was taking 25 a day, and then I was taking like 30 a day. By the time I was 25, I was up to like 250 in a weekend. Right up to using a needle. You know, I still didn't think I had a problem. I still thought I was in control and that I could stop using anytime I wanted. I didn't want to tell my family that I was using needles. So I just told them that my pill popping problem is getting out of control, and I really need to go to treatment. My habit had become such a problem that I couldn't remember when the last time I ate, and I was waking up places that how did I get here type of thing. I was laying in the hospital room and I thought, like, really sick, you know? I started having feelings that I don't want to do it anymore. It's too hard, you know? So I was 29 years old and I didn't have a job. I had been trying to get my education, get my GED. I had already been to treatment 5 or 6 times. I had stayed clean for a short period of time, and then I ended up relapsing on opioids. I continued to seek treatment and relapse over and over and over again. It was a vicious cycle. And I had been on probation for 6 years, which is a lot. Normal probation is 12 to 18 months maximum. It got too hard to hide, and I had too many failed drug tests, and the judge put me in jail. So I sat there, and I had been using so heavily that the first 4 days in jail were hell. It was the worst experience ever. I didn't want to admit I was defeated again, you know, and then it's so bad that I can't stop. I went from this teenager that had all A's and 1 B, you know, athletic, doing things, to using drugs, criminal activity, you know, being deviant, being dysfunctional in my life. I learned about the Vivitrol drug and other options that were available to intravenous drug users like myself. It was really important to me that whatever I took was non-narcotic, that it didn't make me feel high. I went before the judge and he asked me, "Do you still want to do this?" And I said yes, with my whole heart, you know? And he said, "So, you know, have you decided if you wanted to try something else, maybe Vivitrol?" And I said, "You know what? I think that's a great idea."
Vivitrol is a once-monthly prescription injectable medicine used to prevent relapse to opioid dependence after opioid detox. Vivitrol must be used with other recovery programs, such as counseling. It is not known if Vivitrol is safe and effective in children. Vivitrol may not work for everyone. See the medication guide for more information. You should not take Vivitrol if you are using or have physical dependence on opioid-containing medicines or opioid street drugs, are having opioid withdrawal symptoms, are allergic to naltrexone or any of the ingredients in Vivitrol. You must not take any kind of opioids, either street drugs or prescription, for at least 7 to 14 days prior to starting Vivitrol to avoid sudden opioid withdrawal that may be severe enough to require hospitalization. Using opioids, even in small amounts while on Vivitrol, can lead to accidental overdose. Because Vivitrol blocks the effects of opioids, anyone who tries to overcome that block by taking large amounts of opioids could be at risk for overdose, serious injury, coma, or death. Additional important risk information is presented later in this video.
What I learned in there was that you need to be clean. My appointment for my doctor, I went in, they checked me to make sure that everything was fine for me to take, and it was, and I received my first shot. After I got the Vivitrol shot, the injection site was very sore. I had some headaches, and I was fatigued.
Some patients had severe skin reactions, including tissue death, at the site of the injection. Some required surgery. Call your doctor right away if you notice intense pain, blisters, the area feels hard, an open wound, swelling, a dark scab, lumps, or any other skin reaction.
The important parts of my recovery were getting my Vivitrol shot and making sure to make it to my counseling appointments. When Vivitrol was added to my recovery program, it really helped reduce my cravings and helped keep me from relapsing. I turned around and I reflected and I took a look, and instead of saying I can't do it, I felt like, yeah, this is possible, I can do this. I was on Vivitrol for about 6 months, and during that time, of course, I went to my counseling appointments. But what I've learned is that it doesn't matter how hard you try to deny the problem or to beat the problem or to put on this show for other people that everything's fine, that eventually, over a period of time, the ugly face of addiction is gonna show itself. Recovery is really hard, but there is hope. There are options available. I am still continuing to discover who I am. I realized that I've always been a strong person. That was something that I didn't realize before.
Additional important safety information about Vivitrol. Do not use opioids in amounts that you used before Vivitrol treatment. You may even be more sensitive to lower amounts of opioids after detox, when your next Vivitrol dose is due, if you miss a dose of Vivitrol, after you stop Vivitrol treatment. Get emergency medical help right away if you have trouble breathing, become very drowsy with slowed breathing, have slow, shallow breathing, feel faint, dizzy, confused, or have other unusual symptoms. Tell your doctor about any injection site reaction that concerns you, gets worse over time, or does not get better by 2 weeks after the injection. You must be opioid-free before receiving Vivitrol unless your doctor decides that you don't need to complete detox first, in which case he or she may give you Vivitrol in a medical facility that can treat sudden opioid withdrawal. Naltrexone, the active ingredient in Vivitrol, can cause liver damage or hepatitis. Tell your doctor if you have any of the following symptoms of liver problems during Vivitrol treatment: stomach area pain lasting more than a few days, yellowing of the whites of your eyes, dark urine, tiredness. Depressed mood. Sometimes this leads to suicide or suicidal thoughts and behavior. Tell those closest to you that you are taking Vivitrol. You or those closest to you should call your doctor right away if you become depressed or have any new or worsening depression symptoms. Allergic pneumonia. Tell your healthcare provider if you have shortness of breath, wheezing, or a cough that doesn't go away. Serious allergic reactions. Get medical help immediately if you have a skin rash, swelling of your face, eyes, mouth, or tongue, trouble breathing or wheezing, chest pain, or are feeling dizzy or faint. Common side effects of Vivitrol include nausea, sleepiness, headache, dizziness, vomiting, decreased appetite, painful joints, muscle cramps, cold symptoms, trouble sleeping, and toothache. These are not all of the side effects of Vivitrol. For more information, ask your doctor. Tell your doctor right away if you have any side effect that does not go away. See the medication guide for more information. Call your doctor for medical advice about any side effects. You are encouraged to report negative side effects to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Ask your doctor if Vivitrol is right for you.